If you haven't heard yet, we have entered a new era, new phase of the pandemic where America is telling public health officials to pound sand. Take, for example, the media hype about the new vaccine, the Omicron vaccine. CNBC writes where to find the COVID boosters for Omicron from Walgreens and CVS to local pharmacies and clinics. Someone should let them know that less than half of the country got their first booster. Even fewer got the second one. You might remember when media outlets breathlessly reported on kids getting the vaccine. There was live TV programs about getting the vaccine and the kids who did. Well, the vaccination rates tell the story. Only 7% of infants have received the first dose. 38% of 5 to 11-year-olds have rolled up their sleeves. That means 62% have not. 70% have not gotten their first dose for kids 5 to 11 years old. Even some state and local leaders are reading the room and deciding to walk away from public health measures. In the nation's capital, schools delayed enforcement of the COVID vaccine mandate until next year because the vast number of the students did not even have the vaccine. If you're in New York, you no longer have to mask up on the subway. The governor wanted to restore some sense of normalcy just ahead of November's election, where she's up for re-election in New York. A coincidence for sure. Dr. Amesh Adalja is here, senior scholar at the Johns Hopkins Center for Health Security. How does the public health world transition to this time where people are going to start making decisions once again on their own?
That's traditionally how public health works. It's not by mandate. It's not by forcing people to do things. It's by giving people guidance and recommendations based on the best evidence and then letting people make those decisions in the context of their own life. And I think that's something that was lost throughout much of this pandemic because we were worried for a long time about hospitals going underwater and not being able to provide care. And I think that really alarmed people. And that's why a lot of the things that should have been done voluntarily and with harm reduction principles were done with mandates and abstinence only type of principles.
Is there a discussion now about how to get back to that and go back to convincing and informing and teaching and rebuilding this trust? Because there's now so many Americans who will just do the opposite of whatever the head of the CDC says.
In many ways, this to me is going to be the long tail of the pandemic, this breach between public health authorities, infectious disease authorities, and the public. And I think that's because this got sucked into politics and identity politics. And now we are, exactly as you say, in this situation where people will just not do something because they don't want to be told this is what they should do. And I think we have to recalibrate, because if we are faced with a more severe pandemic or even a pandemic on the scale of COVID-19 again, we're going to need public health authorities to be helping guide response and guide policies. And we have to restore that, or we're going to have the same type of mistakes repeated over and over again.
You know, you talk about the long tail. I think it's a great way to talk about it. And we look at some of the CDC's changing guidance. Don't need a mask, vax don't need a mask, get a booster, wear a mask, don't wear a mask, on and on and on. Everything changed. Where does sort of the idea of science as an evolving, changing thing meet what we were told over and over were these ideas that at the time appeared to be true and later were proven not to be? Does there need to be that acknowledgement?
That's something that should be done up front, that when people are giving recommendations, they should say, this is what we know now. This is why we're making this recommendation. These are the contingencies that we don't know about, and we'll make updated recommendations. But oftentimes during these types of responses, people want a one-size-fits-all, very simple message, and they get away from that nuance. And it can come back to bite you if the general public then loses trust because you weren't nuanced. And I think we have to get back to communicating effectively. I think people are able to handle that type of nuance. And I tried to do that throughout the pandemic, but many of my colleagues kind of want this yes, no, on, off type of approach. And that's just not going to work, because it's never going to be one size fits all when you're taking science and applying it down to people in their individual lives.
You know, you're right that you have done that. You and I have talked literally since COVID-19 was still the COVID virus from Wuhan, all the way back in January of 2020, which is why we keep having you, because of that nuance. I still am wondering, though, from your perspective, if us being so cynical and thinking, as we mentioned, Kathy Hochul, pulling the mask mandates off just ahead of the election and the like. Are we right to be that cynical?
I do think that politics has gotten completely integrated and intertwined with this response, and we have many political leaders who look at this infectious disease emergency as something that can either be a political win or a political loss, that they do polling and focus groups around it. And that's not the way you want to run an infectious disease emergency response. You basically want the politicians to be completely left out of it. This should really be about scientists, public health authorities, physicians, and the general public. Just like it was, for example, the 2009 H1N1 pandemic.
Yeah,
or conferences from Atlanta, not from the West Wing.
Yeah, or in AIDS. The long tail of the pandemic. Well said. Good to see you, Doc. Thank you. We'll be right back. Thanks for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to subscribe. Click the red button to get more of NewsNation's fact-driven, unbiased coverage.